Could you also just, briefly touch on the health plan? Because it's something a lot of people don't talk about, but I know for my daughter and for many of my friends' kids, that's a really essential part of the IEP, not to be overlooked. So is there anything you want to say that parents need to really think about with that health assessment?
A health plan is, first off, if you need a health plan, it should be a part of your IEP. That seems obvious to a lot of people, but there are some districts that I'm familiar with that will do what they call an IHP, which I think is Individualized Health Plan, which is a separate document that the school creates. But because it's not a part of the IEP, it doesn't have the legal protections that an IEP has. So if you have a health plan, it should be incorporated into your IEP. A health plan is needed when kids have a medical condition that the school needs to be on top of. An example might be if they have an allergy to peanut butter. That is a severe allergy. If there's a seizure protocol, or if your child is going through chemotherapy for cancer, right? It's those things the doctor says, make sure the school knows to do whatever. And the health plan outlines who does what if this medical issue happens, and who they call and what they do. Do they just call mom? Do they call? And obviously, if it's God, hopefully not, but if it's life-threatening, they're going to call 911 regardless of what the health plan says. If they have an exposure, let's say, to a food allergen, that's not causing breathing problems, but just a rash. The health plan says, do they call mom? Do they call 911? Do they administer Benadryl first? It tells them what to do. It's informed by your doctor. And it should be included if you have an IEP in the IEP.
And it can also help with with staff training.
Yes.
My daughter has an epilepsy plan. And so that means that, whenever somebody new comes onto her team, they're going to be part of that training of what is the protocol if something would happen at school. And it requires the team to all be informed. So there isn't just the one person right in school that might not be anywhere near them that knows what to do.
Yeah. And the health plan will say things in it like team will be trained on how to, whatever the thing is that needs to be done. And I recommend that parents include in that new staff, if there's, however you word it, but if there's a staff change in the year, because a lot of times that training happens at the beginning of the school year or when the IEP happens. And then if you have turnover of the classroom aide or the PE teacher or whatever, they don't get that training. So I like to include for new staff.